Albert Einstein said, "Only a life lived for others is a life worthwhile." This simple saying symbolizes the entire healthcare field. Doctors and physicians live their lives for the betterment of others. They share a common goal: create a better life for those in need. Many people ask themselves, what can I do to make a difference? This overwhelming question has a simple answer for me: find my passion and pursue my dreams. Hello, my name is Kieran Feeney, and today I'm going to share my passion with you: pediatrics. A pediatrician works with children and families by diagnosing and treating their medical diseases and needs. For as long as I can remember, it has been my dream to become a doctor. Throughout high school, I've taken steps to turn that dream into a reality. As you can see, my resume highlights my qualifications. My community service is exceptional while holding several leadership positions in honorable organizations such as Hastings Mayor's Youth Council Vice President, Adams Central FBLA Vice President, and being a finalist for the position of Nebraska FBLA State Secretary. However, my most impressive feat is being appointed to the Nebraska Governor's Youth Advisory Council. On this council, I meet with Governor Pete Ricketts of Nebraska and discuss issues present in today's state and country. It is a great exposure to politics and allows me to network with my fellow peers from across the state and from across the nation. Collectively, these organizations have prepared me for the role of leadership that I will assume when I become a successful pediatrician. The summer before my senior year, I knew that I needed to start job shadowing. I was put in contact with a local pediatrician and was fortunate enough to job shadow at Children and Adolescents Clinic in Hastings, Nebraska. I was the youngest to observe in the clinic since all the other students were in medical school, completing their rotations for the residency programs. This meant that I had to work extra hard to prove myself, and I treated this job shadow as serious as any job that I've ever had before. For 3 months, every Monday and Friday, I would go into the clinic and shadow Dr. Daniel Leonard. It was unlike anything that I'd ever experienced before. Every time I walked into the clinic, I knew that I would see other physicians treating patients and making them get well. And seeing the pediatricians treat children and get them well, and having a family's day just be a little bit brighter because of what I would do, that was when I realized that this was something that I wanted to be a part of for the rest of my life. Over the past few years, I have been fortunate enough to job shadow and volunteer at numerous hospitals and clinics around the state. I've been given the opportunity to volunteer and job shadow immunization, hematology, internal medicine, physical therapy, and pediatrics. And pediatrics appealed to me the most. In the field of pediatrics, you are able to help those who aren't able to help themselves, making the job that much more rewarding. If I were to become a pediatrician, I would be able to better the life of a child, and that would mean the world to me. At Children and Adolescents Clinic in Hastings, everyone always had great energy and positive attitudes, which always resulted in a positive work environment, and that is something that I look for in a future career. Every time that I walk into the clinic, I knew that I'd be greeted with a smile and waves of positivity. And every time that I would leave the clinic, I knew that I'd be more knowledgeable about the job duties and responsibilities of a successful pediatrician in a smaller community such as Hastings, Nebraska. Mary Lanning Hospital is one of the most well-known medical institutions in the state of Nebraska, and it is very well known by surrounding states. I'm fortunate enough to live in the community that supports Mary Lanning Hospital, and I'm a part of their junior volunteer program. This program is designed for high school students like myself to gain exposure to the medical field and allow us to get some community service hours at the same time. My experiences throughout the junior volunteer program have resulted in many networking options that many of my peers would dream of. I have worked side by side with top healthcare providers in the state and in the nation, and I've gained their recognition by being named Junior Volunteer of the Year in both 2018 and 2019. My dedication and many hours volunteered to this program have resulted in creating and long-lasting networking connections that I know that I can rely on if I ever have a question about the medical field. According to the U.S. News and World Report, a beginning pediatrician can make almost $138,870, and an advanced upper-level pediatrician can make almost $194,770. However, I'm not pursuing this career for financial benefits. I simply want to help people. Money is inconsequential in comparison to saving a child's life. According to the United States Bureau of Labor Statistics, a pediatrician is a very favorable occupation. The job openings are expected to increase by 7% by the year 2028, creating excellent job security for my future career. There will always be children who need taken care of, which means there will be always jobs created for the field of pediatrics instead of doing away with them. In order to start practicing medicine, I must accomplish certain academic standards. For financial reasons, I plan on attending the University of Nebraska Medical Center, where I will gain my Bachelor of Arts degree in Humanities. And then after that, I will attend a 3-year residency program, which I will tour and study at top research facilities and hospitals around the nation. After this, I will claim my Doctor of Osteopathic Medicine degree instead of the traditional Doctor of Medicine degree. I've found that osteopathic medicine is a more practical way for pediatricians to use, so I'm claiming that degree instead of the traditional Doctor of Medicine degree. Now, a pediatrician can have excellent training and be externally prepared for their position, but he would be feeble in his efforts if he did not possess the skills necessary to enter the medical field. Communication is important when entering the medical field. You communicate with a wide variety of people on a daily basis. You have to understand complex medical terminology to be able to communicate with your coworkers, but also be able to use layman's terms when discussing the diagnosis with the patient and the patient's family. Compassion is great to be a mediocre doctor, but is a necessity when becoming a pediatrician. You have to remember that you are not just working with the patient, but the patient's family as well. And from start to end, you have to guarantee satisfactory caring manner for patient care. Finally, organization is one of the most critical parts of being a pediatrician. Organization is a great way to exemplify efficient, effective patient care. Organization is used in everyday facet of a pediatrician's workday and almost any other medical occupation. These three simple yet necessary skills can turn a mediocre pediatrician into one of the most well-respected physicians in an institute of medicine. I have seen it done before. And this is how I will make my difference in this world, by becoming a pediatrician and changing the lives of those in need for the better. My bedside manner and charisma will allow me to build a foundation of trust and communication between the patients and the parents. I have found that it is unique to find a physician that the patient looks forward to seeing and the parent fully trusts with the well-being of their child. Throughout my many years of experience in the healthcare field, I know that I am that unique physician. Thank you for your time.